Hi, my name is Shelby. I'm going to do the cardiovascular and pulmonary video assessment. This is my patient, Ivy. So I'll first start with the chest. First, I'm going to inspect the chest. I'm going to see if she has symmetric expansion. She does. Can you sit up straight for me? Shoulders are even. She doesn't appear to have any disconfiguration of her thoracic cage. The muscles are symmetrical. So then I'm going to go ahead and palpate the chest. I'm going to check for sub-Q air. There does not appear to be any sub-Q air. She doesn't have any work of breathing. There's no appearance of intercostal muscle use. So now I'm going to go ahead and check and see if she has any tactile fremitus on the anterior portion of her chest. So whenever I put my hand on your chest, can you just say 99?
99, 99, 99, 99, 99, 99.
So each time I did that, I was checking to see if she had vibrations in her chest. And she did, and they're symmetrical. So then, as I was checking in her chest area, I was also checking to see if she had any tenderness. Is there any tenderness? There doesn't appear to be any tenderness. There wasn't any masses that I would be concerned about. So now I'm going to go ahead and auscultate her anterior lung fields. First, I would start above the clavicle and then move down in a ladder-like position or ladder-like direction, going from the above the clavicle to the second intercostals, fourth, fifth, and on the sides. So her lung sounds were clear and equal bilaterally. So now I'm going to go ahead and check the back side of her chest. So I'll come around here, and so I'm going to do the same thing that I did on the front side, palpate and inspect. We'll inspect first. Her shoulders are equal and symmetrical. Scapulas are not protruding out. They don't appear to be disconfigured. So I'm going to do the same thing and check for tactile fremitus on the back side. If you can say 99 for me.
99, 99, 99, 99, 99, 99.
Okay, so same thing as the front side. I found there to be symmetrical vibrations on each side. Bilaterally, it was all good. There was no masses or tenderness upon palpation. So she doesn't have any work of breathing or intercostal muscle use on the back side of her chest either. I'm going to go ahead and percuss her posterior lung field, so I'll use that, do that using my middle finger, and I'll tap it. So I found there to be some resonant sounds upon the percussion of her posterior lung fields. This means that I didn't hit the bone. It was on the muscles and in between the intercostal spaces. There were, upon percussion, because of the resonant sound, that means that there's not any fluid in her lungs. So now I'm going to go ahead and auscultate the posterior lungs. I would avoid the scapula on this auscultation, and then also whenever I get down to the lower lobes, I'm going to go laterally because that is the only place that you can listen to the middle lobe. So just breathe each time. So again, her lungs are clear and equal bilaterally. I'm going to go ahead and do some sound tests. The first one I'm going to perform is the whispered petroquility test. So on this one, each time I put my stethoscope on her back, I'm going to have her whisper 1, 2, 3. I shouldn't be able to hear anything during this test. Okay, so I did not hear anything. That means there's no disconfiguration in her lungs, no fluid in her lungs. So at this time I'm going to do the bronchophony test. I should be hearing her say 99 during this test. So just say 99 whenever I put my stethoscope on your back.
99, 99, 99, 99, 99, 99.
So I did hear her saying this. The voice vibrations came through my stethoscope. This is a good sign and it's a normal sign. So the last one I'm going to check is the agophony test. This time I'm going to have the patient say E. If I was to do this and I heard through my stethoscope more of an A sound, that would indicate that there was something further that needed to be investigated.
E, 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 E.
So I did hear E on each time. So again, that is a good sign. So now I'm going to go ahead and listen to her heart on the front side. So first, I'm going to palpate her carotid artery and look at her external jugular veins. There's no JVD distension. And upon inspecting her chest, there doesn't appear to be any very apparent pulsations of the heart, which is a good sign. So her vein is not distended. And then I'm going to check her carotid pulse. I wouldn't do it on both sides at the same time in case it would block the blood flow from the brain. So now I'm going to listen. So I didn't hear any bruits, I didn't feel any thrills. That would indicate that there would need to be some further investigation if I did. So this is a good sign. So now I'm going to listen to her heart sounds. First I would do the second intercostal space on the right sternal border. This is the aortic valve. The second intercostal space on the left sternal border is her pulmonic valve. Down to the third on the left sternal border is Erb's point. The fourth and fifth on the left sternal border you can hear the tricuspid valve there. And then fifth intercostal space, mid-clavicular line, would be the apex of the heart, and that's where you can hear the mitral valve. So she has a regular rate and rhythm, heart rate of 62. So if I did have a stethoscope that had a diaphragm and a bell, I would listen to each of those spots again to hear if I could hear any murmurs, or for example, if I listened to the aortic valve, I would listen for aortic insufficiency, having them lean over. Um, Also, the bell is good for hearing the lower heart sounds like the murmurs that can't be really heard using the diaphragm part of the stethoscope. Um, but like I said, I don't have one of those. So this concludes my assessment. Thank you.